Hello and welcome everyone. My name is Dr. Lianov. I'm the president and founder of the Global Positive Health Institute, and welcome to our GPHI podcast series where we talk about all things related to positive psychology, lifestyle medicine, healthy lifestyles, health and healthcare. And today I'm delighted to have with us Dr. Mike Parkinson, who's been a longtime friend and colleague in preventive medicine and lifestyle medicine communities. We're trying to change the world together. He's trained in family medicine and preventive medicine. And really looking to transform healthcare. So we're very like-minded that way. And most recently, he was the medical director at UPMC Health Plan. So welcome, Mike.
Thank you, Liana. Liana, it's so good to see you again, and Happy New Year to you and all your fans and listeners. It's well deserved.
Well, thank you. And let's just get right to it. What first grabbed your attention to the power of a healthy lifestyle? And we also talk about the positive psychology, health behavior change piece. What first said to you, like, wow, this is where we really need to focus?
You know, Liana, I'm so appreciative of this chance just to sit down with you one-on-one, albeit almost bi-coastal. Because I hadn't taken the time to really think about that until you sent me a few straw man questions for our discussion. And I think without knowing it, I was very blessed by having a couple of parents who just believed that they could take on the world. And they were dreamers. They didn't have two pennies to pinch, but they decided that they would just try different things and move different places. And over the years, I saw that can-do attitude, which I didn't even realize I was being modeled for me. My dad actually used to teach Dale Carnegie courses on positive speaking. How do you persuade an audience? Because he really believed that you always learned more from listening than by talking, but the way that you could bring people out was a power that you needed to have. I think next, the major milestone for me was in medical school. I went in Washington, D.C., and the dean of my medical school would disappear every afternoon around 2:00. He was a thoracic surgeon, and he would go up to his office and hang a sign on his door, now closed, that said, "Do not disturb, the dean is meditating." This is in the late 70s. And I'm thinking to myself, who is this strange guy who goes, and what's this meditation all about? He was decades ahead of anybody. And then in my psychiatry course, I learned about this physician, Dr. Benson, and the relaxation response. And I think then I began to realize that I didn't know much about this mind-body connection at all. Then on my journey, I mentioned I was in the Air Force for 20 years. And I met these wonderful 18 to 21-year-olds who were so inspiring, volunteered, put up their right hand, put their lives at risk, difficult missions, a lot of challenges, totally motivated by purpose, esprit de corps. Absolutely, they weren't always the brightest people, but they were the best heart. And I just realized the motivation overcame a lot of things, physical ailments. Pilots who would frankly lie to me as a flight surgeon to try to stay in the cockpit because they so loved what they did. They were so connected to their purpose in life. And then finally, on a personal note and deeper, I didn't realize how important in my upbringing religion was and spirituality, a sense that you're connected to something bigger. And as I got older, I kind of returned to my church and just find it's a source of strength. When you have setbacks, that there's a greater good, there's a bigger purpose that we don't always know. We can't know it, and we're kind of have a lot of hubris as human beings. So that humility that comes with spirituality, I think, is good. The last thing is I've always been connected to nature. Growing up in the West in Colorado, when we moved back east, so it was fishing and it was skiing and it was hiking in the outdoors. Again, a sense of humility that we lost a little bit, I think. So those are all things. And then, of course, so you and I meeting a few years ago now, but realizing that this is an area of medical awareness that is totally underappreciated. And frankly, now that we have the basic science to show that the power of how this works at the subcellular level, it's the right package at the right time. And boy, do we need it medically and socially, right? So long-winded answer, but multiple milestones that I bet you all of your listeners probably have in their life, not the same as mine, but there's some ways that these touch points they had where they just felt better, where they felt more purposeful. Call it positive psychology, call it social, call it nature or connection to the environment. All of those things are therapeutic, and we just don't get enough of it.
Yeah, we experience it. We know it when we get that sense of vitality. And then it's wonderful that the science has come along to show that indeed,
Right.
We've got this evidence. And so we need to be promoting it in our self-care as well as in our healthcare. And I think you alluded to this in your response already, but maybe dig a little deeper about how you're now using it in your personal life and then in your professional life. How does a healthy lifestyle with positive activities, what does that look like for you?
Sure. So I think you mentioned in the intro that I recently transitioned from, a very kind of a traditional medical director position in a health plan, which I was doing about 3/4 of my time. But I always, for my own sanity, given the challenges of the healthcare system, even good, hardworking people, as we all are, and doing the best we can, what I realized is that my spark comes from trying to have impact to change things more than the status quo. So I always preserve 25% of my professional life for an innovation portfolio or a transformation portfolio of things that I personally believe were important to change, to make the system better, to improve health faster, to reduce costs quicker, to make companies more successful. I've done a lot of work with employers. The Air Force is just a big employer. Nothing's more motivating than to be associated with a team of people to do something important, which is why I think most people go to work. Yeah, you get a paycheck, but what motivates you most is seeing Liana every day or seeing the people that you do, which is why we were hollowed out by COVID so much. So I always try to associate with people or concepts that I think are transformational and hopefully less than a 50-year life cycle to have an impact. That's one thing I do. Because I get, it's interesting, a psychiatrist colleague of mine at UPMC, when we talked about health coaching, for example, and the fact that we're health education, vanilla health education, as you and I learned it, it really doesn't produce much. But coaching does, where it's, skill building and teamwork and support, all those things. And so Dr. Lauren Roth, who is one of the founders of UPMC, a psychiatrist, fascinating mensch who actually did some of the work in Russia as the head of a US commission to determine whether or not prisoners were really, quotes, psychologically disabled, or were they just politically put there. Talk about sensitive. But he said, Mike, he said, it's pretty simple. He said, the only type of learning, whether it's self-learning or helping other people, that sticks is experiential learning. So getting your hands dirty, rolling up your sleeves, getting into whatever it is. And so that's what I try to do, is help people get experiential learning. And likewise, I try to say to myself, what can I do to not only reinforce some of the skills I have, but what's some new things that I can work on, or new things that I can do. And so today I just completed a book I'd recommend to all of your viewers, and it's called A Silent Fire by Dr. Shilpa Ravella, a Columbia gastroenterologist. It's all about the hidden disease of inflammation that is the Rosetta Stone of so much of the disorders we have. But she is a wonderful writer, goes back centuries to find that the story, it's a thread that's been there forever. It's one that we forget and then we rediscover. So this is my little psychic income for today. I felt good about myself because I finished this book. So that was a good thing. Look for a little psychic income. My father-in-law is an economist. He said, people think economics is all about GDP and money supply. He said, no, he said, those are just markers
Yeah.
and poor markers for what is psychic income. What drives Mike? What drives Liana? What drives? And once you understand that, and you can basically go to that bank and you put some more psychic income in there, that's the essence of, I think, of positive psychology, knowing your why, knowing what drives your psychic income, and being a little selfish, trying to make sure you get some of that every day. Then you're the best for everybody who sees that, and you become a role model without even saying you're a role model.
Well said. You're really talking about the crux of positive psychology, which is these positive emotions that then, are adding to that psychic income and psychic bank account that we can draw from during difficult times, and to keep us resilient, or even not even have to bounce back. We just remain strong in a good way. But you also mentioned how you're building in to your regular life things that are meaningful, and in terms of changing individuals' lives, changing the bigger system. So meaning is a crucial part, as well as you talked about the social connection, who we see on a regular basis that we look forward to, that gives us those positive interactions, are so essential. And this feeling of accomplishment or achievement, right? You read the book, you're always setting new goals where you're challenging yourself. And then when you succeed, even partially or fully, that boosts our positive emotions. So that's why I love these interviews, because everyone has their own way of describing the core truth of what we're talking about here. So I appreciate that.
I was just, what you were saying again, and unfortunately, getting back to, you mentioned lifestyle medicine, and and I give you credit for writing if anyone's not read your 2010 JAMA article, which I call the Rosetta Stone for the entire practice of lifestyle medicine. Liana and another colleague, Mark Johnson, summarized a 2-day meeting of all the major specialty societies in primary care and related specialties back in 2009 to say, what did we as physicians miss? Well, we missed a lot. We missed the science of what drives health and what drives disease, frankly, and got lost in the medical treatment model, which, is hard to confront sometimes and do it. But in the process of that, I'm reminded of a recent book by Dr. Robert Lustig, who's out at Yearway at UCSF, or some of your old stomping grounds, who reminds us that so much of our modern environment is all about pressing the lever of constant dopamine, whether it be salt, sugar, and fat in our food, social media, gambling, other forms of addictions, 24/7 on cycle, no parasympathetic nervous system, no serotonin, all those type things. The good dopamine comes from the type of interaction you or I are having. Right now, if I could measure my dopamine level, it would be going up because I'm talking to Dr. Lianov, on this webinar. And so there's nothing wrong with being social about the good ways to get your dopamine level up and to reinforce those, rather than the, unfortunately, disease-causing ways that have now, sometimes corporate interests and others have basically hijacked to get in the way of us doing those things that really allow us to have the good cycles of the ups, and also the quiet times and the restorative times. I mean, the other discovery that I've made is, we talked a lot about the 6 domains of lifestyle medicine at the Lifestyle Medicine Research Summit in 2019, which your viewers hopefully can look at the paper from that summary. I, even at that time, did not appreciate the power of restorative sleep in terms of brain damage, in terms of removing cellular debris, in terms of turning off the sympathetic nervous system. All of these drivers get in the way of positive psychology if they're not aligned. And so, is it possible to have meaningful social connections, positive psychology, if 90% of my calories are coming from added salt, sugar, and fat? I don't know. You can't really do the experiment, but it sure is harder because your brain's all inflamed. Right? And so you're not a good listener. You don't have as much patience. You might be depressed. They're all interconnected, right? I'm singing your song here, Dr. Lena.
Again, well said. And as we're keeping in mind that many of the folks listening are health professionals in various capacities, some of them may be looking to fully integrate what we've been talking about, a healthy lifestyle, into their practice as far as what they recommend and how they what they use to treat their patients, but some may be just thinking about it or just struggling because, as we well know, the whole lifestyle medicine community knows the healthcare system isn't designed to remunerate this kind of work, even though this is the quality healthcare that we're looking for. So what advice do you have for everyone who's like, oh, I want to do more of this? How do I do this?
Can I tell a brief story? Because it leads right into this.
Sure.
So I've had the opportunity, a blessing, to advise many employers and large organizations around what's broadly coined as a health and productivity strategy. There's nothing wrong with productivity. We all want to be productive as individuals, as parents, as friends, as colleagues, as leaders. And it relies on health, both mental, physical, social, all those things, as you know. I was able to work with an international banking organization in Washington, D.C., and I got to know the medical director of the World Bank, which many of you obviously have heard of. And the story of Dr. Jim Kim, who had left the presidency of Dartmouth to come and take over as the CEO of the World Bank, in addition to being obviously an economist, because you have to be an economist to head the World Bank. He's also a physician. He was an internist and clearly a very talented, big brain person. And he came into the World Bank, and the first thing he did is he traveled to all the World Bank offices around the world and met all the senior leadership, came back and immediately laid off 1/3 of all the senior managers of the World Bank. Absolutely unheard of. Nobody ever got laid off from the World Bank. It was lifelong employment. And these are some very powerful people. And when asked, why did you basically eliminate 1/3 of the senior managers, he said, it's pretty simple. They didn't know why they're the World Bank. He said they didn't have a servant's heart. He then took the remaining 2/3 that were left, and he brought in about 15 saffron-robed Buddhist monks. And they went into a multiple-day retreat. If you know Washington, D.C., and he sat down all of them in a room and said, ladies and gentlemen, I'm delighted that you're here with the World Bank. We're going to spend a lot of time getting to understand your why. Not why are you at the World Bank, but why are you on this planet? Because if you don't understand Liana's why, I can't have you as a leader at the World Bank. You cannot be a leader at the World Bank. And through walking silently down Pennsylvania Avenue, down Constitution Avenue, beautiful spring day, they saw for the first time Washington, D.C., although they worked there for 20 years. They heard the birds in the trees. They heard the fountains, that were there on the mall. They saw the Vietnam Memorial, and just in quiet. Nobody talked. They weren't allowed to talk. They were just totally aware. And it was covered in the Washington Post, the newspaper, saying, what type of protest doesn't have anybody saying anything? They had never seen such a thing. So my advice, as I said, is understand your why and flatter your patients by asking them a simple question. Why are you here? What do you expect out of engaging with me, and how can I help you? The humility that expresses to your patients. If you did nothing more than that, don't worry about the CPT, don't worry about the notes. That patient will go away bonded to you than ever. They may not be able to answer the question, but if you pretty much say with them, I am here to support you reaching your goal, whatever that is. I want to be a better dad. I want to basically see my kid, graduate from high school. Whatever it is, honor them by asking the why. And when you do that, you'll be a better practitioner. And you will automatically realize that the things that they really want, they can't articulate, but they want positive psychology. Yeah. They want social connection. D. Eddington, who was one of my heroes, many people know D. Eddington, to study what risk factors lead to disease on employers. And he once told me, he said, Mike, he said, I've been in front of a lot of groups of employees And when I asked them, why did they come to work today? Not a single person ever said, I want to lower my risk factors. They come to work because they want to feel valued. They love being on a team. They want to make a better car. They want whatever that is, but we never ask the right question. And instead we pigeonhole people into ICD-9 codes and even the 6 domains of lifestyle medicine. And they start with this, what you need to do, Liana, is we don't wave our finger anymore, but we do in our attitudes. What a turnoff that is. Patients hate it. They get out of there and said, no way am I doing what Dr. Lianov even suggests. She doesn't even know me.
Yes. And again, it's that lifestyle medicine from the inside out, or healthcare medicine of any kind, or health of any kind starts from the inside out. And then we
honor the inside. There you go, Leon. Honor the inside of the people you work with.
Yes.
That means you got to understand them, and you got to be humble enough to just, like my dad said, just be quiet and listen. They will tell you, but no one ever asks. So we're aligned in the way we want to transform self-care, healthcare. So if we were to succeed in the future, what would that ideal future look like in terms of self-care and healthcare? Well, for the 7 years that we started up, some of your listeners may know the term consumer-directed healthcare, where we started health savings accounts and we started health reimbursement arrangements. And they were just financial vehicles to express empowerment, to basically say, of course, I'm not going to ask you to pay money for a mammogram that works to detect early breast cancer. Of course, I'm not going to ask you to pay for a colonoscopy for the second leading cause of preventable cancer death in the United States. But yeah, I'm going to ask you to pay a lot for a Z-Pak antibiotic that you probably don't need for upper respiratory infection. And it's $68, and you're going to pay the full price, and it's going to count. You're going to hold it a minute. Dr. Lianov told me it probably was virus and I didn't need the antibiotic. I should have listened to her. Okay, so education and empowerment around self-care. We have taken health education out of the schools. We've taken it out of the home, and we've said that Dr. Lianov is going to fix me. Wrong answer. So my future state would be health literacy starts with what I ate that morning, how I move, how I think, what's my sense of purpose, and getting all of us on a trajectory towards aspirations that honor myself and honor the people I care about. After that, any down day, sickness does not pay for anybody except the healthcare system. And so what we have to do is incentivize good health by empowering people to become more health literate, and then aligning the macro forces around that to reinforce that. So Dee Eddington also famously said, Mike, stop talking about behavior change. He said, people don't change behaviors. The environment around them changes and they align with it. So creating microsystems and environments around people, they'll figure out the magnetic fields and realign it. But if you have the wrong magnetic fields and we try to help ourselves and patients to do everything against it, it's an uphill battle. And that's what we've got to do, is talk about not just individual choice, but also system alignment, which of course we talk about too. So I would say to all of your listeners and fans out there, make sure that wherever you are and whatever your profession is, whatever practice that you're in, that you become a change agent for the microsystems in the home, in the school, in the neighborhood, on the street, in the workplace, because otherwise our message, scientifically correct, just falls on fallow ground.
Oh, yeah. Terrific. So you've, I think, incited our listeners to want to learn more if they don't already harmonize with what we're talking about. And so what are some of your favorite resources? You mentioned a couple of books already. What are some of the go-tos that you think everyone really should be familiar with?
Well, this is a big brain book, but you've got a big brain audience. I'll say this as a compliment. Years ago, when I was at the Surgeon General's office, I walked into the Surgeon General, who was a 3-star, and those of you who have a military background, I was then a lieutenant colonel, which is like a pretty bold thing to do. And I plopped the book down on his desk and I said, with the door closed, I could call him by his first name. You never call a 3-star general by his first name when there's other people around.
Yeah.
I said, Chip, I think we should read this kind of for the senior officers book club. We called it the Mitchell Group. Billy Mitchell was an irreverent Army Air Corps officer who was so bold to suggest that there was enough difference in something called the Air Force that it should be a separate service from the Army. And he was court-martialed. So we, in the spirit of constructive revolution, we called our reading group the Mitchell Group, right? So one thing I would do is propose to your listeners, they form a Mitchell Group in whatever group they are, because every organization gets stale and it gets bureaucratic and it doesn't change fast enough. But the name of the book is called Consilience by E.O. Wilson, the famous ant biologist at Harvard. And consilience is one of my favorite words. It means the unity of knowledge. So human beings are smart, and we're maybe the smartest organisms to our detriment also on the planet. But we love to see silos and stovepipes because that way we can break down the world. Consilience means the unity of all knowledge. Yeah. And if you think about, and when you read this, it really draws you up to such a high level where you see that what we're trying to do as people and health professionals is bring together the power of shared knowledge and the power of the unity of knowledge. It's kind of a foundational book, which I think is very at the macro level. In the healthcare space, I'm still a big fan of Michael Grieger, How Not to Die. I gave him that for a long time. He's a colleague of ours, and I like him very much. And I would say both of these recent books, the other one that I would show you is by a internist and cardiologist, Body on Fire, How Inflammation Shapes Everything. I think if you're not an expert on inflammation and how it plays out in every organ system of the body, when you talk to your colleagues in nephrology or cardiology or endocrinology, the consilience of disease pathway is inflammation at the cellular level. So you can become more powerful if you speak to their disease and say, look, chronic renal failure is just the same disease. This just happens to be in the kidney. How can we work together? And unless I can help people address their why, that chronic renal failure patient is going to be on a faster slope to stage 4 disease and dialysis if they don't change what they eat, if they don't exercise. Yes, they should exercise. All those things reduce cytokines, IL-6, CRP, C-reactive protein, all these things. But that consilience, because the body doesn't think in organ systems. The body just thinks in systems. It's one system,
it's
right?
One system.
Which is why
Absolutely.
this fictitious mind-body dichotomy. It's like, what do you mean? It's the body. The body. If the body could talk to us and go, "Are you friggin' crazy?" It's just Mike. It's just Mike. There's no mind Mike. There's no kidney Mike. There's no liver Mike. It's crazy. So I'm just going off the deep end here, but you do that sometimes.
Those are great resources, and I was not familiar with the consilience, and so I'm going to book, and so I'm going to go get that. I'm excited to break into that. Thank you for that.
It's not a light beach read, but I think you'll enjoy it. It's really good.
Well, as we close up, do you have any parting words? Like, what's the main take-home message people should walk away with after listening to us?
Well, some of this comes from, listening to you talk over the years, Liana, and it's really an interesting thing is that we sometimes think we have to feel something before we act differently. And what I think is so powerful is the mere act of doing something actually starts the way you change the way you think. So even when you don't feel up to doing something, even when you are a little cautious, or don't get into an uncomfortable zone that gets you beginning to do things that you thought you could never do. And you may not do them perfectly, and you may not do it 100% of the time, but as you do it, you are building your own personal confidence and resiliency. But you can't do it sitting in your room staring at a computer screen. It's got to be, we are hardwired for physical activity and for things that we can look back on at the end of the day and said, I actually did that. I actually did that. And if you can make a little list of something you did, and you don't have to tell anybody, but you should be able to read it yourself and said, I did this today, and tomorrow's going to be a better day. And then listen to other people, ask them their why. Those are the two things. I'm so tired of being an expert, lectured to by experts. If I'll go to an expert and ask them advice, but they have to understand a little bit something about me. I'm going to be selfish first. But if they don't care to know, then I probably don't want to spend any time with them anyway. So that's okay.
I love it. I keep those lists of my accomplishments, and that gives me that boost. Like, wow, I did those things. Because as you're going through minute to minute, day to day, it doesn't feel like much. But then when you put it together, it's like, oh, well, that's significant. Yeah,
that's your psychic income. That's your psychic income for that.
Builds that psychic income.
Put it in the bank.
Thank you so much, Mike, for joining us on this podcast. Maybe we'll bring you back sometime. And thank you to our listeners to this GPHI podcast. And we hope to see you on another one of these in the future. In the meantime, be happy, healthy, safe. Until next time, take care, everybody. Bye-bye.
Thank you. Bye-bye.